We're a next-generation accountable care organization. So our UnityPoint Health, we're responsible for about 88,000 next-generation Medicare beneficiaries that are attributed to our organization, that we're kind of responsible for making sure to improve their patient experience, their patient outcomes, and also to reduce cost and improve efficiency. And so through that, my focus is on the post-acute care space. So we have a network of about 95 skilled nursing facilities across Iowa, Illinois, and we work with those preferred providers to improve the patient experience, to lower the length of stay, and to lower rehospitalizations and ED utilization. And we did a pilot project in one of our regions, Peoria, Illinois, where they used MCG in helping them try and get the control of their SNF population and lower their length of stay, and it was quite successful, to the point that we decided to roll it out across our entire network at the same time as we were building our post-acute care SNF network. And since then, we've been able to significantly impact our average length of stay, while at the same time lowering rehospitalizations through a variety of programs, policies, and tools, one of which has been MCG. And so for the Doyle Award, we put together basically all the information that we've worked on over the last couple of years, which has been just a number of colleagues throughout our entire network at UnityPoint Health, as well as some key people within our ACO that have worked together collaboratively using the tool, and we've had good success at that. And so whoever reviews the Doyle Award felt that that was worthy of coming and telling our story. We have teams, the nurses and nurse practitioners that work with our preferred providers, those SNF partners. They follow our next generation beneficiaries from the hospital into the nursing facility. And sometimes, because we're next gen ACO, we're actually able to move patients from the clinic or even from home or observation stay into the nursing facility. And so our care teams follow those patients either in person or telephonically into the skilled nursing facility. They talk about what their care plan is going to look like, and we use the guidelines from MCG to help us drive the discussion about how long they should really be staying. We know that the goal length of stay is just a goal, that each patient's care plan needs to be individualized, but MCG allows us to document variances and to include notes, and so we were able to have competent discussions with our partners about the patient's length of stay, and we've been able to reduce our length of stay across our network by almost 8 days.
Wow, that's great.
So it's been pretty significant, yeah. It's been around almost $1 million a day. But we're still trying to realize, all of the financial implications, and there's other factors, but we've also seen a reduction in rehospitalizations, and so that's a big cost savings as well. We have trend lines that show, we were starting to lower length of stay already in early 2016, but after MCG, the trend line seems to drop quite a bit faster.
We do know for sure, based on results on our performance in NextGen, that this had a significant impact on how we addressed our cost savings, and MCG was a very significant component, almost as valuable as that person who walks into the facility to have that collaborative conversation.
We're looking at expanding our post-acute care network. We're adding new SNFs each year to our network, depending on where our footprint lies. We're certainly looking at, we've brought down length of stay, like I said, 8 days. We want to continue to try and drill that down without sacrificing the patient experience. So we're tracking rehospitalizations really closely with that. We want to be able to parse out now. We're getting to the point now where it's we need to be more specialized in how we're looking at the data. So breaking out patients, not just from a regional perspective, but looking at MDC codes, looking at DRG codes, and so that we can focus in on a region. Where are the regions struggling the most? Is it with musculoskeletal conditions? Is it with heart failure, circulatory, respiratory, things like that? To try and drill down and provide support to our regions, who then in turn can provide support to those SNFs that might be struggling either with length of stay or rehospitalization for a particular condition code. And I'm sure we'll be able to utilize MCG to help with some of that evidence-based background.